Hello, my name is Natalie Wills. Today I'm going to be discussing the examination of both male and female genitalias. So we'll start with male. Prior to getting started, you want to make sure that you fully explain to your patient what you're going to be assessing, why you're going to be assessing, if it would be a male physician, or even if the patient is uncomfortable, you want to make sure there is either a chaperone or somebody with the patient to make them more comfortable during the exam. So with the male genitalia, you want to first only expose the area that you're going to be assessing. You're going to talk them through it, and you're going to try to make them feel comfortable and be as natural and comfortable as possible. So you're going to unveil the drape, or you're going to expose the area you're going to be assessing. First, you're just going to look. So you're going to look, depending on their age, you want to look at if there's any pubic hair, if they're developing into puberty. You just want to kind of assess. You want to make sure that there's no lesions. If they could have been exposed to any herpes virus infections, you want to assess. You want to assess the penis and the shaft. You want to make sure there's no drainage, any pustules. If there are drainage or pustules, you want to sample that. Make sure that you're doing a full exam and assessing to make sure that they don't have any sexually transmitted diseases or infections. And if they do, you want to properly treat them and educate them for further preventions. So when you are assessing and palpating, you want to assess if the patient is circumcised or uncircumcised. If they are circumcised, you're going to be able to fully visualize the penis head to do a easier exam. If they are uncircumcised, you want to make sure that you pull down the foreskin so you can have the head exposed to make sure that you're fully able to see all aspects of the penis. Again, under the penis head, you want to make sure that you don't see any lesions or ulcerations or scabbing or anything that would be red flag or concerning. So you want to palpate down the shaft. You want to palpate the scrotal area. You want to make sure that you can feel the two testicles. You want to make sure you don't feel any additional cysts or masses. You want to make sure there's no extra tender areas. You want to palpate on bilateral sides to make sure for any inguinal hernias. Typically, if they are complaining of any scrotal pain, you could do a further workup. If you don't see anything, you could prescribe like an ultrasound or get them further evaluated. So as far as a female exam, you're going to start out, do the same thing as well. If they require a chaperone or they want their parent there or anything, just to make them feel more comfortable. If they want their parents to leave, anything to make them feel as more comfortable and have a natural exam as possible. As far as the female exam, you want to just expose them as well, only in the area that you're going to be assessing. We can start off with a breast exam. A breast exam is part of a female genitalia exam. They should be doing self-breast exams themselves pretty regularly, and you want to educate and encourage that as well. You want to palpate around the breast and around the areola as well. You want to palpate, make sure you don't feel any masses, lumps. You want to assess both breasts. You want to make sure there's no drainage from the nipples, anything that would be cause for concern. You want to make sure if they're of age that they're following up and getting yearly mammograms. If there's a history of breast cancer, you want to especially make sure that they're following up. As far as the vaginal exam, again, during puberty, you want to see and assess if they are developing any pubic hair, if everything is on track with their age and puberty progression. If you're going to do a pap smear, you want to insert the speculum on a side angle. You want to enter it completely until you, and once it's completely inserted, then you can expand it and clip it into place. Once it is expanded, you're going to be able to have a good view of the cervix. So you want to place your swab and get a sample of the cells in your cervix. You want to make sure you get a good sample the first time because it can be very uncomfortable for women to do a pap smear. So you want to make sure that you get the sample and then you have a good sample for the lab to send that out. When you're removing the speculum, you want to close the clamp and then turn it, make sure that it's on the side angle that you entered it, and then remove it in one smooth regression. You want to also make sure that you do close the clamp prior to removing it, otherwise that would hurt because you're opening the vagina to assess the cervix. Also, you want to, after you do the speculum, you want to insert a finger so you can palpate the ovaries and the abdomen. Make sure you don't feel any lumps or lesions, any masses. Again, you can also prescribe a transvaginal ultrasound as well as an abdominal ultrasound if you do find anything abnormal or you're questioning anything. It's better to be safe than sorry. For both male and female, if it is warranted, you can do a rectal exam. With the rectal exam, you want to assess the anus. You want to make sure that there's no fissures, external hemorrhoids. You can palpate to feel if there's any internal hemorrhoids. You want to make sure that there's no fistulas or anything that would be cause for concern. Also, they would have complaints of any anal leakage or anything that would be an issue. So you want to make sure that everything is, that they're not feeling any different or have any complaints. And that is it.